Good evening and welcome. I'm Roy Blitzer, and our show is Ask Dr. Business. The purpose of our time together is to give information and insight that will help you, the working people of the area, and have a job that's more satisfying and rewarding. Our series on jobs that require travel continues, and our guest this evening is lovely Nancy Moss, who is a health science consultant at present. But previously, many years, she had traveled in almost every job she had, and she's going to talk a little bit about her experiences on the road. The number, should she want to call in for us, is 650-856-1491. Welcome.
Thank you.
I'd like it if you could tell our audience a little bit about your background, where you studied, and what kind of travel jobs you've had.
Sure. My undergraduate work was done at Sarah Lawrence College outside of New York City, and I did mostly sociology or social sciences, and then detoured a little bit through Europe. I spent a year in Paris studying, and then a year at the London School of Economics, a subsequent year in Birmingham at the University of Birmingham. Also doing kind of socio-cultural studies, and ended up as a graduate student at Stanford in sociology of education, but actually concentrating, as many of us did at the time, in healthcare.
And that's where you started your traveling career.
That is true.
Tell us a little bit about the kind of travel that you did, and what were some of the requirements of the job or the career, as we talked about when we prepped.
Yes. So initially, as a graduate student and as a postdoc in my fellowships, you travel primarily to conferences. The goal is to meet people, to start to have your research known to other people, to get a good feeling for the field and what the important questions are that people are asking. My field was initially more sociology, excuse me, and a little bit less health, but over the years it became much more about health, particularly the health of mothers and their babies,
So if you went
women.
and did a study of international babies, then you
Yes.
probably were gone all the time.
Well, that came more towards the end of my career. When I began very domestically doing most of my research around Santa Clara County, particularly
That's
in
just
San
freeway
Jose,
work, right?
Right, where we traveled back and forth to local hospitals, and but ultimately ended up working on global clinical trials for the National Institutes of Health.
Well, talk a little bit about what it was like to have two different sort of places of business. You had one in California and one in Washington?
Yes. Well, I was very lucky to be hired in 1989 to work at the National Institute of Child Health and Human Development in Rockville, Maryland, Bethesda, Maryland. And I packed up my youngest son and we moved. But I always kept my house in Palo Alto. It wasn't sold.
That was a smart move.
So initially we were just traveling back and forth to see family, but after I had been there about 4 or 5 years, about 4 years, I guess, I was offered a job in the Bay Area at the Hewlett Foundation, but I was very reluctant to totally leave the job at NICHD.
So you had two jobs.
So I worked out for about a year, 15 months, I can't remember exactly how long, I actually split my time between the two coasts.
Well, tell us what that was like. What was your routine? Were you 3 days one place and 4 days the next? How did you manage that?
You know, it's a little bit difficult to remember the exact number of days, but I remember more about the quality of the flying and that I started to dream a lot about United Airlines, and I even remember some of the dreams. And as I told you, Roy, when we were chatting before, I learned to keep my suitcase always packed at the end of my bed and my little toiletries case always ready to go.
Did you have much advance notice? Did you have to book your tickets far in advance?
Well, some, but the amazing thing is that it wasn't just the commute. It sounds like it was just the commute, but also both of those jobs required a fair amount of travel. For example, when I was working for Hewlett, I went to the International Conference on Population and Development in Cairo, Egypt. That was 1994.
Right.
And that happened to be, I think luckily it was in the fall. So my youngest son had just started college, so I didn't have to worry too much about being gone so far.
So you were traveling internationally for both of these places? That's a lot of travel.
No, I wasn't yet traveling internationally for NIH, but I did other travel for them because I had program officer responsibilities at different sites all over the country. So
talk a little bit about mileage, but before you do that, let me encourage people to call with some questions. I'm here with Nancy Moss, and we're talking about her life on the road. She is a health science consultant who's now not traveling as much, but her history of where she's been and how she's done it deserves a little bit of a rest. Please call in. The number here is 650-856-1491.
Well, I will say, Roy, that once you we were talking a little bit about acting, once you get in that role, you can kick into it right away. I mean, I can still be wiped out and maybe just going to London to see friends, but the minute I walk into the airport, that's me. I've got my gold card. I go to the right line. I know exactly what I need to have in the cabin to be comfortable for 12 hours. And I spent many years, too, traveling to Asia when my son was living for 17 years in Singapore and Beijing.
These are long flights, Nancy.
Right.
Do you wear suppose stocks? Those,
No.
No?
No, I don't.
Did you walk around? What are some of the things you do for these long flights?
Now they've changed the configuration of planes. Of course, they change that all the time. But there was a period in there, I would say, between about 1995 and 2005 and I only fly United, when some of the long hauls were configured so you could do yoga back there between the galley and the restrooms.
Wow. Now talk a little bit about the mileage obsession. When we were prepping, I was intrigued by the fact that you were as you mentioned, a mom with 1 million miles?
Yeah, a mom with 1 million miles. That would be a good book title, actually.
Well, you can take it. I'll give it to you.
So I think this really was an unintended consequence of my postdoc programs, that I was surrounded by somewhat...
We have a caller for just a moment.
Oh, okay.
Jennifer, this is Dr. Business. How can I help you?
I would like to ask Nancy, how did she stay healthy doing all of this traveling?
Oh, I think that is, I'm so glad that came up. I'm fascinated to hear your answer. Health.
Well,
how did you stay healthy? Did you wipe out the little counters each time with...
Well, there's two aspects to it. I'm not sure quite what
Answer both
Jennifer
of them. That's
intended,
perfect.
but one is definitely, it has to do with the surfaces. I remember being in a hotel at our project site in India. This is in Belgaum, which is a small city nobody's ever heard of, in a hotel where they had run out of toilet paper, actually. And I was traveling, because I do mothers and babies, I was traveling with a midwife colleague who literally went around the room swabbing the walls.
Interesting.
But it was about 10 years ago or so. I actually have not done that. I'm not that bad. But in terms of my personal health, I almost always had my running shoes with me, and I've been lucky to run in many, many cities.
So you run when you
around
get
the
off
world.
the plane. What do you do to stay healthy on the plane? They say the
Yeah.
rejuvenating
Your immune
air is
system.
getting us sick anyway.
I never drink alcohol. I don't
Ah.
drink much anyway. I only drink water. I always have a water bottle with me, which I fill when I get behind the lines in the airport. I don't buy it. I drink lots of herbal teas on the flight.
Well, this is good information.
Yes, I carry
Do you
some.
eat the meals?
I carry some tea bags. I carry my own food for the most part, just in
Wow.
case. The airplane food is, it used to be better. It's not very good. And even in business class, which I've been fortunate occasionally to be in, you can't really depend on it. So I make sure I have nuts and fruit, sometimes egg salad.
And then you had the yoga opportunity.
And
in the old
yes,
days.
And you can buy shelf liner that you can use as a yoga mat. So you can just put it, weighs nothing and takes up no space in your suitcase, and then you can do some yoga in your hotel room.
Okay, that's
Yeah.
a great answer. Jennifer, did that help your information source?
Yes, it seems like she traveled and she was very prepared.
Yes, and I'm going to take some of those ideas. I have a huge flight coming up myself. Thank you very much, and I'm pleased
You're
you
welcome.
called. Let me just refresh everybody's memory. I'm Roy Blitzer. Our show is Ask Dr. Business, and we're here with Nancy Moss. She is a health science consultant who's talking about her life of travel. The show is really a specialty on jobs that require travel, so please call in. The number is 650-856-1491. Speaking of health, I'm fascinated
Sure.
to find out as a young mom, what did you do when your kids got sick? How did you handle the responsibilities of being a mom when you were on the road all these?
My children, I have 3 sons, they never got sick. They
That's wonderful.
never got sick.
I hope
And
they're listening
if
now.
anybody had a problem, if they fell and had a bruise or bump, they were directed to the ice bags in the freezer. Nobody got coddled. Nobody missed school for illness. They didn't get sick. The only time I had a problem was after taking my youngest son on a college tour and driving him from DC all the way up through New England. I
They
took
got
to
sick.
my bed after that, but no, I didn't have a problem with.
Great.
Childhood
Now
illness.
talk a little bit about the responsibilities of coming home. You mentioned that your suitcase was always packed. Did you have a routine when you returned? And how much time did you have in between trips?
Well, that is a really good question. And I have to differentiate the period of time when much of my travel was domestic and I had children at home, and then the time when most of my travel was global and there were no children at home. I only cooked, the latter time I used cooking as relaxation.
Oh, really?
I was lucky to be able to, buy pretty good food in my neighborhood in DC, but I never used the oven. I lived in an apartment for 5 years in DuPont Circle. I never used the oven. It was pretty much what was expedient.
This was before Whole Foods and
No,
Trader
it
Joe's.
wasn't before
It wasn't?
Whole
Oh, good,
Foods.
good.
There was a Whole Foods on 17th Street.
Oh, good.
Or not 17th, but N Street or somewhere, not too far, yeah.
They have great
not far.
takeout.
Yeah, that was fine. In the earlier years, we did a lot of pizza. Probably didn't spend as much time cooking.
Well, what about the mail? What did you do when you came home to,
Piles of mail.
piles and piles
Yeah.
of mail and the...
Yeah.
I'm fascinated if you have any
Yeah.
routines. If you were gone when your
do.
bills were due,
I
how did you
do.
handle that?
So that is something I learned to do. I always pay my bills on the 15th of the month. And if I know I'm going to be away, I used to sort of arrange all the envelopes so they could be mailed. And now I sit down on the 15th and everything is done online. And if I'm traveling, you can advance schedule your
That's true.
payments. So it's really not difficult to do. That's not difficult.
Well, do you have any packing tips since you're giving all these wonderful pieces?
Sure. Black.
Black. Men black or just women black?
I can't speak for men. I can
Okay.
only speak for women. But for one thing, I have traveled a lot in countries where modesty is really
important. So
important.
long skirts.
Anybody who's traveled, as I have, to Pakistan or to India, knows that, and in Latin America, too, I mean, really, in a lot of places, it is just more appropriate to be
Covered up.
and to look fairly tailored and professional. And you can do it with just 2 or 3 items of
Do you
clothing.
roll or flat?
I roll. I'm a roller.
Oh, good.
Yes, and I only ever bring one bag and a little backpack with the 2 pockets, one for the water bottle, one for the mug, the stainless mug, and that's it. That's
Well,
it.
you have this
Yeah.
down. What about shoes? You have the running shoes to get exercise.
Always running shoes and, maybe 1 or 2 other pairs.
I'm very impressed.
Flip-flops to keep your feet off the floor.
Right. Let me remind everybody to please call in. The phone number here is 650-856-1491. And we're here with Nancy Moss giving us wonderful tips on her life on the road or traveling. And please call in. You may want to hear some interesting things that will make your life on the road somewhat different.
Roy, one thing that would be really fun to talk about maybe is how some places, we talked about food on airplanes, but you can find yourself in places where there really is virtually nothing to eat. And I have had that experience.
Then how do
You laugh, but if you're out in the middle, in the arid plains of northwestern Argentina, where people are very poor and there are no tourist amenities, where are you going to pick up
So
food?
how do you handle that?
You just make sure that you always
Bring some
have
gorp with
some
you?
nuts, some high-protein power bars, perhaps some dried fruit, and be prepared to or some cheese sticks.
Cheese is good.
Cheese sticks. Those mozzarella sticks. I'm serious.
No, I love that's
You're
a great piece
laughing,
of
but
advice.
This is really important.
Well, I think did you keep those already wrapped too, or no? You've had to take those
Well, you
with
have to
you.
refresh
Yeah,
them
refresh it.
and so on. But I've been known to travel with like a pound of cashews. But lots of countries, you can buy nuts.
But I think that's a great piece of counsel.
But seriously, and also because you might have some hygiene problems. Some
Well,
food
usually
hygiene
the
problems.
places where you can't drink the water,
Yeah.
then you have to brush your teeth with bottled water, and that's not an easy.
No.
You must be an expert.
Another tip for your folks, your watchers or listeners who
Viewers,
who
we'll call
travel,
them.
is you may not always have a room that's perhaps warm enough for you. So traveling with something that you can wrap yourself up in is very important. I stayed in a hotel in Brazil where they didn't have glass in the windows and it was really cold out.
I never thought of bringing a
Yes.
blanket. That's a great
Well,
idea.
a wrap, a shawl, anything, a fleece, something. You wouldn't think of Brazil
No.
as being cold, but,
The beach of Ipanema, that's what you keep thinking of.
and even in India, you can be on the high plateau and it can be cold in the winter.
Talk a little bit about what advice you would give someone who is thinking of taking a job that involves lots of travel. What would you tell them? How would they set their minds to be ready for that kind of life?
I think really working on keeping an open spirit, an open mind, being ready to hit the ground running wherever you end up in the world is incredibly important. You don't have time. If you're working and you're in a high demand job, you can get off the plane anywhere and you need to be able to function. So you have to, if it's yoga or just deep breathing or drinking certain kinds of teas or just being really centered in how and prepared in how you approach things, there's no time to improvise.
Also, flexibility, I would
And
think.
being
You needs to be
flexible. Oh,
somewhat
yeah.
loose.
Yeah.
You talked a little bit about some of the changes in your own approach to travel. Like you had mentioned when we were prepping that you were initially a little nervous about. How do you handle that? What do you tell people
Yeah.
who are nervous travelers
Sure.
that have jobs that they have to be on the
It's
airplane all the
true.
time?
I used to have fear of flying. You know, I found turbulence very unnerving, but it's like anything else. We know that exposure hardens you up, and a few abortive takeoffs and landings, and you realize that you're probably going to survive anyway. And if your plane drops 40 feet in a storm over the Pacific, tighten your seatbelt.
Right. Well, I think that's a great, great approach. Let me remind everybody, we have about 8 or 9 minutes left in the show, and I'm hoping that you'd call in with some questions. The phone number is 650-856-1491 for Nancy Moss. I'm interested, even if no one's going to call in, to talk a little bit about how you think the field that you are in handles the travel. If you're working in industry, for example, they say 40% travel, 35% travel, and they usually are underestimating that figure. But you mentioned in the world of research or in academics, they don't tell you how much travel there really is.
No, they don't, because I think it is somewhat unpredictable. But as somebody who worked both in universities and for the federal government, I think it's very subject to budget changes. You know, we have our lean years and we have our flush years. And in the better years when the budgets are better, and of course the government budget and the NIH budget or the NSF budget is going to filter down too to the universities. So if we're having a problem at the agencies, or even possibly with the private funders usually don't have that issue, but then there's going to be less travel, or your travel may be constricted, or maybe you're not going to be able to upgrade. You know, maybe they can change the policy and say, okay, you know, basically everybody's going economy. And I know that happens in private industry too.
Yeah, I also think that when you take a job, some of the marketing jobs, I'm having next month a CEO, he knows that 70% of his job is travel. He took it that way. I think in your world, you may not know. I don't know if they tell you, 40% travel, or you've got to be gone a long time. But if you apply for a grant that's in somewhere in Timbuktu, you have to go.
But for example, in my last job at the National Institute of Child Health and Human Development, my last NIH job, when I started, I was never told how much travel there would be. I only knew that I would be doing projects in India, Argentina, and Uruguay. Others came along.
And you still took it. That's a lot.
You know, I'd been in DC for 2 weeks. I had just managed to get my car there, and I was told that I was going to be going to India for 2 weeks or something or other. But even when I first went many years ago, I had been in the job for a couple of weeks, and my branch chief said, I want you to go to Atlanta because I think you can do a presentation at CDC about our program and talk a little bit about high-risk infants and infant mortality and blah, 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 and what our program does. Sure,
well,
okay.
It sounds like you were a very committed and dedicated employee. When we were prepping, I'd ask what happens if you said no, but I guess no one ever says no.
You never say no. And no, you never say no.
Because in private industry, if you say no, it's a career-limiting situation.
Definitely. That would be absolutely true in research, too.
Really? Okay.
Yes. It's so globalized now, you have to travel. It's completely globalized.
Now, one of the things that I think is interesting about a female traveling, have you noticed anything different in the attitude towards women, either on the road or traveling, when you started traveling and now?
Oh, that's a good question.
I only want to ask you a good question.
Honestly, I don't think there's a big difference. I think there's a bigger difference among countries and cultures than there is really across time in the U.S. Yeah.
So
I-
you were never considered unique or special as a female that had 1,000,000 miles in her docket?
I suspect there are a lot of people who have done the kind of work I do that also have 1,000,000 miles of flying behind them, or more, possibly much more. But I think it really is more as a mother, and I was a single mother for a long time.
Oh, that must be
That's
very
the big
difficult.
difference. And I have gone to symposia, I guess you would say, where working mothers who were doing international work talked about their travel. And I can tell you the bottom line there is that it's much easier if you can stick roughly to the same time zone that your children are in. So if you're based in North America, travel to South America is much easier than travel to India. And that would be true for people in business.
Now,
too.
if we asked your kids how they felt about having a mom that was not gone all the time, but certainly traveling all the time, what would they say?
Oh, I wish the youngest were listening because
I wish
he's
he-
the one who bore the real brunt of it. He'd probably say he managed. We managed.
But in one
And-
sense, they must have been proud of you. You're doing such good work.
Well, in fact, that is the child who followed in his parents' footsteps. So, and he himself works in public health.
Well, we won't have any stats on this, but do you think he would take a job that traveled if necessary?
I think he's more of a homebody.
Well, usually the
He
reaction
reacted.
is, yeah.
He reacted. He's much more of a homebody.
And I'm wondering if there's a more of a male willing to go to travel than a female going to travel because of the role expectations.
I don't know. I don't know. I really.
Well, it's something to think about.
It depends whether you think it's fun and exciting to be out there meeting new people and going new places, or if that is something you can live without.
Well, we have about 1 minute left, and I wanted to ask if you do any personal travel in the 30 seconds we have left.
Absolutely.
Oh, so it didn't sour you.
I love to travel. Yes.
Well, I want you to know that you've excited us for traveling with your answers. I wanted to wish everyone a very happy holiday. I want to thank my crew. We are back on the air on February 16th, where I have a CEO joining us as my guest, and he should have a whole new set of perspectives on jobs that require travel. Happy New Year, happy careers, and thank you very much. This is Dr. Business signing off for the evening.
Thank you so much.
Thank you.